Well, good afternoon. It's a pleasure to be with you today. Before I get started, let me just give a little brief introduction about the whole topic of supplements and how this is going to help in the understanding and the treatment of diabetes, and if you're unfortunate enough to have it, what you can do about it in the future. Having been a practicing doctor for 28 years, I understand how the medical profession looks at supplements and vitamins in general, and there has been an evolution over the last 20 years to a more accepting view by the practicing physicians out there. You have to understand that here in the United States, most practicing doctors very rarely saw anybody that suffered from vitamin deficiencies, because the American diet, even as bad as it is at times, we do get enough usually of some of the major vitamins, so we don't see people running around with rickets and scurvy and beriberi and all these diseases that may be common elsewhere. So the average American physician is just not attuned to taking care of it. Most American physicians are attuned to treating problems, not preventing them. That's not to say that American doctors aren't into preventive medicine, but realistically, you go to a doctor to get fixed. They make their money by fixing a disease. They don't make money by preventing you from getting it. Okay? So there's been a shift in the attitude, because over the years, the last 15 to 20 years, there's been a boom in the vitamin and supplement market. Okay? And doctors and researchers are now looking back and saying, you know, some of these treatments that have been around for 2,000 years, that come from Ayurveda, from Chinese medicine, from all sources around the world, people even in primitive areas of the world that have no access to physicians, they had their medicine men and their shamans that came up with useful plants and extracts to treat people. One thing that's happened in the last 2,000 years is that we have gained a lot of knowledge. Your average 8th grader knows more science than Leonardo da Vinci could ever dream of. But they're not smarter than Leonardo da Vinci. American or human intelligence hasn't increased in the last 2,000 years. We just have more knowledge to work with. So people 2,000 years ago weren't stupid. If they ate a plant and it killed them, they didn't eat it again. If they made a tea from a plant and people got better, they kept using it. And that's how a lot of these natural treatments developed over the years. The difference between the ancient medicine men and the doctors of today is that today we can take a plant, we can find out the chemical structure, extract what's important from that plant, and use it. The people 2,000 years ago knew it was the right thing for you. The problem was you would have to take so much of it to get the amount of medicine you needed out of it. So it wasn't as effective as it could be. Now with the use of being able to extract these items and put them into concentrated form, we can now get the benefits of this 2,000 years of experience. Okay? And naturally in the medical world there's always going to be resistance. Doctors are always resistant to change because they want to stick to what works. And having to admit that things were not as they predicted is difficult. I can remember a time where if you had a sore throat and went to an ear, nose, and throat doctor, if you weren't a smoker, they would actually tell you to go home and start smoking. Okay? So things have changed. And medicine changes slowly. And right now is an opportune time to be able to use supplements properly, now that we're getting to understand how useful they are. Remember, we are a constantly evolving organism. What I mean by that is the bones you have in your body right now are not the same bones you had when you were born. The skin you have is not the same skin you had. Your intestinal cells are not the same cells you have. These things are constantly being renewed on a daily basis. And you need the right nutrients to keep them being built properly. Last week or a couple weeks ago I mentioned about the brick house. Well, if you have a brick house and you're constantly changing the bricks, you need to have the proper bricks and mortar to reassemble your house so it doesn't look like anything went wrong. As we get older, what happens is we don't replace what we lose as quickly or as efficiently, and therefore we need the proper nutrients to keep that system going. Now, when we talk about diabetes and the risks of diabetes, we try to break this down into two major categories. Now, obviously there is a genetic link to diabetes. Some people just have a genetic predisposition that cannot be controlled. Most of these you're familiar with, the people that don't manufacture enough insulin, and these are your insulin-dependent diabetics, used to be called juvenile diabetes. People were born with this disease and was recognized at an early age. Later on, we noticed that people became diabetics in their late 20s, 30s, particularly in their 40s and 50s, and some of these people did require insulin. But it wasn't because they weren't making enough insulin, it was because the insulin they were making wasn't being used by their body. So they became insulin resistant. And this is our classic type 2 diabetes. And over the years, this has been treated with diet, with medications, and insulin. And one of the questions I often get is, well, if people are resistant to insulin, why is it that you can give them an insulin shot and then it helps? Well, the reason for that is there are receptors. And by giving an insulin, if you have an overabundance of insulin circulating in your body but none of it is being utilized properly, by actually giving you an insulin injection, it actually overwhelms the receptors, so it actually causes the sugar to be metabolized. But it's because we're giving it more, it's overloading the system. And unfortunately, that has its unhealthy effects, because what that's going to do is cause more fat to be deposited in the liver over a long period of time. And then we end up with liver damage, which we'll get into later. Up until about 10 years ago or so, people were aware of the fact that we have people that develop diabetes later in life, people that develop hypertension later in life, people that develop high cholesterol later in life. And each one of these was treated as an individual disease. Sometimes you'd have one, sometimes you'd have two, sometimes you'd have all three. What was actually discovered is that these are three manifestations of the same process. It is called now metabolic syndrome X. And basically what it is related to obesity. As we age and as we put on more weight, our bodies develop this syndrome X, which can manifest itself initially as any of those three. You might just have high cholesterol and your blood pressure and diabetes may be, for the time being, normal, but you still have the syndrome X. So it would be a simple analogy would be, many of you have heard of the disease lupus erythematosus. People develop a rash on their face. Well, they can get a rash on their face, and that may be one manifestation, but they can also get kidney failure. So just because you have one or the other doesn't mean you don't have the disease. If you maintain syndrome X long enough or don't do anything about it, eventually you're going to have all three. You're going to have hypertension, you're going to have diabetes, and you're going to have high cholesterol. What we want to do now is to aim at preventing that secondary diabetes and basically the onset of syndrome X by controlling our weight before we get to 35, 40, or 50. Some of us do it a little better than others. But the problem is the weight control. And right now, obesity is becoming a major problem in the United States. It's estimated that 65% of the population is considered at least metabolically obese. Everybody has their own definitions of who they consider obese, but from a scientific point of view, it's about 65% of the population. And unfortunately, it's getting worse because childhood obesity is now on an increase. And this syndrome X that used to manifest itself to people in their 40s and 50s you're now seeing in children in their teens and early 20s. Well, by the time they get to their 20s, they're not children, but the problem developed in their teen years. And I have my own personal theory on this, and I think it has to do with a lack of exercise. I think children today don't spend as much time outside running around, playing, as they did years ago. Years ago, you couldn't sit in front of a computer for 20 hours a day. There was no internet. You were lucky if there was anything on television worth watching. So nowadays, yeah, children, there are baseball leagues and they get out and play, but not to the level that children used to exercise in the past. And I think that's the major contributing to the childhood obesity. Not to mention the overabundance of processed foods and fast foods, and unfortunately, a lot of families in the United States do not have a family dinner, or the mother is not preparing a healthy meal for the family. Everybody's busy, so it's running out and getting fast food, be it any variety you want. It's okay in small doses, but as a regular form of your regular diet is not good. So that's how we're developing these problems in the United States. So how do we get from that? This is a quick look of what I've done over the years. For that. Obviously, there's been a boom in the supplement market over the years as people become more conscious of the benefits. And FKC, why FKC? What do they offer that somebody else doesn't offer? Well, it's been around a while. Usually if something is around a while, it means that they're providing a good product. People don't, as I said before, 2,000 years ago, you wouldn't eat a plant that didn't taste good. And certainly nowadays, you're not going to continue to use a product that didn't provide what it said it provided. So obviously being around for 10 years proves that you have a worthwhile product. The other thing is, and this struck me as particularly interesting myself, obviously FKC products are distributed around the world. They could be manufactured anywhere they want. And obviously a lot of American companies go to China, go overseas to manufacture their products because it's cheaper overseas. There's less regulations to worry about overseas, less taxes to pay overseas. So I was thinking to myself, why would FKC manufacture their products in the United States? And I think the reason is, and I could be wrong, this is my own personal opinion, is that the oversight in the United States forces them, or at least proves to the consumer, that they are doing this with the utmost care, and they are not afraid of regulations because they're going to uphold everything that's safe and necessary that's going to be in that product, and you're only going to get quality products. If you have nothing to hide, you don't need to go traveling all over the world to hide it. The other thing is, lots of companies take ingredients and just pour them together and say, okay, this is good for you. Well, there's more to than just adding things to a soup and saying it's good soup. You need to balance the soup so that it works properly, okay? Anybody can boil water and throw things in it. That doesn't make it great soup, all right? Most of the great soups of the world, and I happen to be Italian, so I'm particular to things like minestrone. Everything that's in that soup is there for a reason, okay? There's a oil base, there's a vegetable component and specific vegetables, there's a carbohydrate component to that. So all of those ingredients plus the herbs and spices that are put in there give it a particular flavor, a particular taste that makes it delectable to most people. The same thing happens when you start mixing supplements. You don't just throw things together because it sounds good. Things have to work together, and the word that we use is synergism. And synergism is not something that exists only in science. A good team of any sport has to be synergistic. The players have to be able to work together. Often you've seen where teams go out and they buy 5 or 6 superstars, but when you put them together, they don't play well together because each one of them wants to be the main focus. They're not used to being a secondary focus, so they don't work synergistically. So when you put a product together, you need to do it synergistically. And that's what FKC does with the products that I've examined, is that we put together a synergistic group of substances that are going to yield the maximum result. Obviously, because of the USDA and the inspection and the rigorous process that goes through, the purity of the product that you're getting is assured. Everybody has availability to go out and get astragalus, okay? But how they extract it and how pure it is and how bioavailable it is what makes it useful. And this is another thing we haven't talked about, is bioavailability. You can put something in a pill, you can swallow it, but you have to guarantee that once it gets in your stomach, it's going to be digested and absorbed into your bloodstream. If it doesn't get into your bloodstream and just passes straight through, it doesn't do any good. And that's what purity does for you. It gives you bioavailability. So the products that you take are useful. And we've already discussed the made in the United States, so let's go the wrong direction. All right, we've pretty much spoken about, these are some of the organizations, obviously, that FKC needs to be regulated by, and some of these are voluntary, some of them are not, but yet regardless of whether they're voluntary or required by law, FKC products meet all of the standards that are required. Now, when it comes to living longer, being healthy, and particularly when we talk about weight gain and preventing diabetes by doing this, and the Syndrome X, there are 4 major things: nutrition, exercise, rest, and reducing stress. Nutrition is the one that we can control the most, if you think about it. Every day we have to eat. We have to put something in our body to keep us going. Obviously, there's a limit, you know, people do go on fast. Mahatma Gandhi lived on water for months at a time, but it wasn't exactly the healthiest thing. But for most of us, we need to get nutrition. We have to rebuild those cells that we talked about, our body constantly turning over. And we need to give our body energy. We need to give it a source of energy. You have to put gas in your car. It doesn't run once the gas tank is empty. The same thing with us. We don't run that well when our gas tank is empty. Exercise is important. And we spoke about, you know, children today not exercising. But exercise is not something everybody can do every day. I mean, it's great to say, let's go down to the gym and run on a treadmill for 3 hours. But the reality is that people have lives, they have responsibilities. You know, your kids have a meeting at school. You have to work late at work. You have extra things to do. You may not have the time to exercise. So it's not something that's essential you're going to do every day, most people. Resting, yeah, all of us try to sleep at night. We do need to get some rest. Some sleep well, some don't. There are various factors that control how well we rest. Some of us have to work 2 jobs. You just don't get the rest you need. So that's not something that's sometimes within your control. And finally, reducing stress. Well, most of us try not to induce our own stress. It's usually something in the world that's causing us to be stressful. Your kid just ran away from home. Somebody repossessed your car. We can think of 1,000 things that make us stressful. And a lot of the times, we can't control what happens as far as stress because it happens to us. So when you think about it, the only thing that out of those 4 that we have total control of, unless you happen to be in a coma and somebody's giving you IV fluids, is what you put in your body. You make the decision what you're going to eat. And if you know you're going to not be able to get the right foods that day, you have the ability to take supplements that's going to at least alleviate some of the nutritional deficit that you created for yourself. So we have the ability to control that, and we are the only ones that have that ability to do that. Let's keep Okay, this is pretty much, we've discussed this before. Obviously, we need nutrition to rebuild our cells. The nutrition has to be absorbed. That's the bioavailability we talked about. And obviously, it has to get to the tissues and replace the damaged tissues that our body is creating all the time. Another thing you're going to hear about when we get to the actual products, and you hear a lot about, and I want to explain it first, is you'll hear about antioxidants and free radicals, and a lot of products will have antioxidants. Well, basically, here's what an antioxidant is. We are all dependent on oxygen. Our body metabolism is fueled by oxygen to a certain degree. Well, let me put it this way. The fuel needs oxygen to burn. If you try lighting a fire in a vacuum, you can't light it. You have to have oxygen to start a fire. One of the ways of putting out a fire is to deprive it of oxygen. A lot of these chemical fires are put out by chemicals that actually deprive fire of oxygen. So our body requires oxygen. Unfortunately, oxygen has another effect, and that is the process of oxidation. Things oxidize. If you ever left something metal out in the rain, after a while it's going to get rusty. Rust is the process of oxidation. Our bodies are undergoing rusting all the time. The only difference is it's not iron oxide we're accumulating. What we're accumulating are our tissues are being oxidized, and what's happening is our tissues are turning into biological rust. And the way that works is the oxygen takes electrons from a molecule. And one of the most important molecules that gets oxidized in our body is the notorious LDL cholesterol. And what happens is, as these oxygen molecules are depriving other molecules of their electrons, those molecules are searching around to take electrons from something else, and they're roaming around our body. Those are the free radicals. Now, those free radicals may come directly from inside our cells, as the LDL cholesterol gets turned into a free radical because it got oxidized, but more importantly, by the impurities in nature that are getting into our body. When you drink a cup of water, there may be trace elements in there, trace impurities that we're unaware of that are getting into our bodies. Foods we eat, because of the process these days of spraying fields with pesticides so that the yield is good, by using fertilizers, all of these things are getting into our food source. Even eating things like fish, depending on where you get your fish from, you could be accumulating mercury. Now, the federal government, even if you go out and buy a nice can of Del Monte tomato ketchup, if you look at it, well, it went through processing, they have this plant, it's clean, everything is great, there's nothing in there, right? Well, the FDA allows for a certain amount of impurities in a product in order to be sold. It doesn't say it's sterile, just says that the impurity level is down. And what they allow in there is a certain amount of bug parts, rat feces, rat hair is in the canned foods that you buy. Now, in other countries, those levels are higher because they don't have the US standards. But even in the United States, you cannot totally eliminate these byproducts and these micro contaminants from processed food. It's just impossible. If to make it possible would be so costly that we couldn't afford to eat. So we are going to be inundated with some of these impurities, and that's where we need the antioxidants, because these impurities create the free radicals that damage the cells, that cause things like atherosclerosis, which we'll see in a few minutes. All right, well, this is not an ad for the California governor's race, but Wondermeal is one of the products in the diabetes package. And Wondermeal is essentially a protein supplement that is made from the whey of milk. I don't know if you're familiar with whey. If you take milk, whole milk, and you coagulate the milk, the product that's left over is the whey. And these are the lower level proteins. And by lower level proteins, what I mean is proteins that may only contain 2 or 3 amino acids, or they may have free amino acids. And why is this important? When you eat proteins, they need to be broken down in your body in order to be utilized to help build muscle. By taking a product that has the protein already, for lack of a better description, partially digested, that means your intestines, your body, does not have to spend a lot of metabolism in trying to absorb these and to utilize them. The problem, or what this is trying to do is, in order for you to metabolize something, you need to take in a bigger source of energy. Usually that involves taking in carbohydrates, so that you have to take in the carbohydrates to give you the energy to digest the proteins. So if you take proteins that are already partially digested, you don't have to take in the carbohydrate to digest them. So less carbohydrate means less of a chance of, obviously, first of all, more calories coming in to gain weight, but also reducing the risk of diabetes. Because the biggest cause of diabetes is carbohydrate metabolism, and taking in too many rich starches and carbohydrates. And obviously, Italian diet with all the pasta is not a great carbohydrate, is a great carbohydrate source. Unfortunately, is not necessarily the best thing. Asian diet with rice is not exactly the best diet because of the carbohydrates that you're getting with the rice. Now, someone once asked me, well, if having all these proteins is good because it helps you, you need to burn up your metabolism to use proteins, why wouldn't eating a steak work? Oddly enough, eating a steak works to a degree, and there's actually a diet out there, a high-protein diet called the Atkins diet. And the way the Atkins diet works is all you do is you eat protein and fat, no carbohydrates. The theory there is that you then start burning your body fat and carbohydrates to digest the protein. The problem with that is that, first of all, you're not getting a balanced diet. We do need carbohydrates. The other thing is you develop what is known as ketosis. And ketosis is the breakdown of the fat as a source of energy rather than carbohydrate as a source of energy. And you also have an overaccumulation of amino acids, one of them being uric acid, which is the major contributor or cause of a disease called gout. Back in the Middle Ages, gout was a very prominent disease, particularly among rich people in Europe and also in the Far East. And the reason is, if you think about it, back in the Middle Ages, rich people were the only ones eating red meat. The average peasant and farmer didn't have roast beef and prime rib. They were lucky they got a piece of chicken once a week. So rich people developed gout primarily because they ate a lot of red meat, had a high level of uric acid, and that caused the gout. So the Atkins diet works to a certain degree, but it's not something that you'd want to do on a long-term basis. The Wondermeal, giving you the lower level proteins and amino acids in a more digestible form, is going to give you a healthy alternative to the Atkins diet. All right, now, protein needs to be supplied to the body. Now, typically, a lot of diets have what we call the 30-30-40 combination, which is 30% protein, 30% fat, 40% carbohydrate. That has been shown to be a little unhealthy. So you want to have a little less protein, a little more of the fat than the carbohydrate. And there are 20 amino acids that the body uses. Unfortunately, we need 9 of them from an outside source. We can't produce them. So you can't go on a totally free protein diet. Now there are some proteins in things like fruits, berries, but the likelihood of you getting all you need is not going to be good. So for those of you that like to be vegans and vegetarians, then the Wondermeal is perfect because that's going to add the extra protein, amino acids that you need to keep your body from breaking down. Because eventually what will happen is without enough protein, your muscle mass will start deteriorating. Now, once again, anybody can make milk whey. It's not a complicated product. The trick is in isolating the proper amino acids and delivering them in a form that's pure. That's what the difference is between the Wondermeal and the other products that are out there. Now, we get to the antioxidants. Okay, we've discussed about keeping the carbohydrates low so that we don't gain weight. Also, we talked about what the antioxidants do. Well, one of the things that you need to understand is there are all kinds of antioxidants. Similar to, well, this is probably the wrong example, but there are many antibiotics out there. Okay, one antibiotic is not going to kill every bacteria known to man. That's why we have to have so many. And the same thing is with the antioxidants. You can't just have one antioxidant do everything. And part of that has to do with the chemical structure, limits what chemicals it can react with. Also, you have to consider that inside our body, we have inside the cells. Inside the cells, there are different parts of the cell, the nucleus, the mitochondria, the Golgi bodies. Each one of those has their own metabolism and are selective as to which materials or contaminants are attracted to it. So you have to have antioxidants that are capable of getting inside the cell and in particular going to those individual parts of the cell. You need to have antioxidants that work outside the cell. You need to have antioxidants that work in the bloodstream, that work in the interstitial parts of the organs themselves. And you also have to have antioxidants that are soluble in fat or soluble in water. It's a classic example of the salad mix. You mix vinegar and oil, you shake it up, but they're not really mixed. It's an emulsion. So you basically have to have antioxidants that can attract or go after the free radicals that are dissolved in the fat and the free radicals that are liquid soluble, water soluble. So that's why there are hundreds and thousands of antioxidants out there. The question is finding the right ones, putting them in the right combination so you get the maximum effect. And that's what we've done. Now, before I mentioned the low density lipoproteins, and I think we're going to, one of the major problems with why LDL is worse than HDL is that the LDL gets oxidized very easily and starts roaming around as a free radical. And what it does, it attacks the wall of your blood vessels, and that's the beginning of the atherosclerotic process. So if you want to keep your heart healthy and you want to keep your blood vessels healthy, we need to reduce the LDL, but you also need to reduce the free radical LDL, and you do that with the antioxidants. The Tri-Antioxidant product that we have has some interesting components. Selenium, green tea extract, grapeseed, and pine bark. Selenium is a product that is pretty free in nature, and actually the people that have some dementia and some diseases are found to be low in selenium. Although it is not a trace metal that is completely, it is pretty prevalent, but some people may not get enough of it. That's why it was added. Green tea extract, there's probably been thousands of books written about green tea and the benefits of green tea. So taking that and concentrating it in a form where it's going to be most useful. As a matter of fact, green tea extract is actually 100 times more powerful than vitamin C and vitamin E. So by putting that in an extract, you could drink the green tea, but you might have to drink 10 gallons a day to get the same amount that you would get from taking the Tri-Antioxidant. So basically it's concentrating this. Grapeseed extract. For years and years, people knew that wine was good for you. And then once again, going back to my Italian roots, know a lot about wine. This is basically taking the good part of the wine without the alcohol and getting the antioxidant benefit from the grape seeds. And finally, pine bark. There's a chemical in pine bark. It's called pycnogenol. And this is what actually is the part of or the chemical that actually does the work in the pine bark. And pine bark has been used for years as an anti-inflammatory. As a matter of fact, it was used in some cultures to treat hemorrhoids. So not only is it an antioxidant, it's also anti-inflammatory. So obviously you can see by putting all of this together, you're getting a synergistic effect, which is what we had talked about before. Now, liverite. One of the few things in the Western world, where at least in the Western Hemisphere, and particularly in the United States and Canada, is I don't think doctors or the general public appreciates the function of the liver. People are, consumed with obviously the brain, heart, and to some extent kidneys, but we don't really hear much about the liver. And the liver is probably, I'm not going to say the most important organ, because obviously you can't live without a brain or a heart, but you wouldn't live very long without a liver either. And the great thing about the liver is that it can take a lot of damage. A lot of damage. It's almost like a boat that can be hit with 20 torpedoes before it sinks. You can cut the liver up and leave 1/3 of it, and it will grow back from 1/3 of its origin. If you cut away 2/3, it'll eventually grow back. You can cut livers out of people, and we'll have a picture pretty soon that will show how it can be horrendously damaged, and you'd be surprised how much function is still left in that liver. It is really an amazing organ, and it controls somewhere between 500 and 1,000 different biological processes in our body. And essentially everything we eat goes to our stomach and intestines. Everything that's absorbed out of those intestines passes through the liver first before it gets into the regular bloodstream. So it has to be processed in the liver. So there are multiple liver diseases, and this is an example of a hepatoma, which is cancer of the liver. Now, obviously, you don't have to go to medical school to see a difference between these two. And if you happen to like eating liver, if you went to the butcher shop and that was on one package and this was in the other, it wouldn't take a genius to figure out which one to buy, right? But liver cancer or malignant hepatoma is not the most prevalent liver disease. Most of the cancer that occurs in liver is cancer that came to the liver from somewhere else. So the liver itself is not usually the primary source of cancer. The major diseases that you have to worry about with the liver are cirrhosis and hepatitis. Those are very prevalent, okay? Now, they may not look as ugly as that, but their effects are just as damaging, okay? So liverite was basically formulated to help the function of the liver. And this also has some interesting substances in it. One of them is milk thistle. Now this is milk thistle is very similar to a daisy. And it's in the ragweed family. And it's been used in Western Europe by the monks for years in the Middle Ages as a curative herb. And this is particularly effective on the liver. It was used for years before they even knew what things like hepatitis were, to treat things like jaundice and hepatitis and cancer. So this product has been taken and put into our liverite, obviously with the same extraction process and with the same purity. Schizandra berries. These are one of the, found I believe in Mongolia and China. These are one of the oldest traditional Chinese remedies. And it was used for years in Chinese medicine, even today, and is called an adaptogen. And basically what that means is that it was given to people to help them adapt to new situations, to help their bodies adapt to new situations. In fact, it was used to help people, to give them extra energy before they were starting any extreme physical activity or mental activity. It has the same effect as taking caffeine without the jitteriness and all the other stuff and side effects of caffeine. It is also a great antioxidant, and that's why it's in this product. And it has a lot of affinity for the liver as well. And the other thing which is in here, and I mentioned before, is astragalus. This is also a ancient Chinese remedy, and I believe it was called Wangji.
Oh, that's good.
Is it correct?
Yeah, that's good.
Okay. And this has also been used in traditional Chinese medicine for years. But recently, because of the interest in these products and research being done on them, recently has been shown to be an antioxidant, anti-inflammatory, and anti-cancer medication. So once again, things are not just lumped together for the sake of putting them in there. They're there for a reason. And that's, now, another product that is helpful, because we were talking about weight loss, is the Noon Light. And basically, what this is a combination of the substances that has been put together to take before you eat a regular meal to try to alter the metabolism so that your body doesn't overdo it, so to speak. So basically what's going to happen is it's going to block some of the fat absorption. It's going to prevent the breakdown and the synthesis of new sugars or from the carbohydrates, and it's going to help the protein digestion. So basically it's working to increase your digestive capacity. Now, let me preface this by saying, you can take all the supplements in the world you want, but if you're going to eat a 7,000 calorie meal, this is not going to prevent it from being absorbed, okay? All of this works only if you have a sensible diet, okay? You cannot overeat and expect to say, well, I'll just take some supplements and that'll take care of the problem. That's not going to take care of the problem. But you can eat sensibly without feeling like you're starving. And the biggest reason why a lot of people eat is that if our stomach expands, when it starts to empty out, the stomach wall actually is like flopping around, because it's like blowing up a balloon and then letting the air out, and it's not as tight as it was when you first blew it up. That floppy stomach wall sends a nervous signal to your brain that tells you to eat. Okay? So one of the hardest part of any diet, if you go on a new diet, South Beach diet, Atkins diet, I don't care what diet it is, the hardest part of any diet is the first 2 weeks. Because in that first 2 weeks, when you start cutting back the amount of food that fills up your stomach, anything you take as a diet suppressant has to overcome those nervous impulses coming from your stomach saying, I'm flopping down, you better fill me up. Okay? So that is why when you have to, besides stopping the metabolic process, you have to eat less food. Now, if you do it all at once, it makes it hard. I've always been a proponent of the fact that you can't suddenly go from eating a lot of food to eating less food in one day. I think it's a lot easier to do it over a period of a couple of weeks so your stomach gradually shrinks down and you don't get this nervous feeling. I also used to tell patients of mine, all of these diets that you buy a book for, you go to Barnes and Noble, and in the nutrition section there'll be 300 books on different diets, and all of them will work. The problem why most people don't stay on a diet, for me, is that usually when you start a diet, they always have 20 things that you never eat or don't like to eat. And you'll force yourself to eat them for 2 weeks because you want to lose weight. Or you want to, fit into a new shirt, new bathing suit, whatever. You have a wedding to go to and you want to wear the dress you wore 2 years ago. So you'll force yourself to eat things you really don't like because you know you're going to lose weight in 2 weeks. The problem is after the 2 weeks, you just get tired of eating that stuff. You don't want to keep eating it. So I said, if you want to really lose weight, you have to learn to lose weight eating things that you like to eat. Now, that doesn't mean that if you eat bacon, you're going to have bacon every day. I mean, there are certain foods that, realistically you have to at least cut down on. But you're not going to tell someone from China never to have rice again. You're not going to tell an Italian never to eat pasta again. It's not going to happen. Or have bread. It's not going to happen. Or no, don't eat pizza. So I would say, listen, if you had lunch every day and you were eating 3 slices of pizza, next week eat 2 slices of pizza. Third week you eat 1 slice of pizza. So when you get down to your diet, you're eating the same food you like, maybe a half a slice of pizza. You're not going to not eat it because you like to eat it now. So besides cutting down calories, that's where we need to supplement what we have. And that's why this is important, because you are not going to be able to maintain a constant weight loss diet and feel like you're full. A weight loss diet is usually somewhere around 1,200 calories a day. That's like a slice of strawberry shortcake. Okay, you're not going to live on a slice of strawberry shortcake a day. You're going to eat. So if you maintain a reasonable diet between 1,200 and 2,500 calories, and you're taking noon light, which is now going to reduce the number of those calories that actually get into your system and get metabolized to, let's say, 1,800 calories, you're not going to lose 15 pounds a week. But at the end of the year, you may have lost 20 pounds. That doesn't sound like a lot. But if you take 20 pounds of fat and piled it up in front of you, trust me, you'll notice it. Most people, the problem most diets fail, in my estimation, is everybody wants to lose 20 pounds in a week. But if you tell somebody they're going to lose 2 pounds a month, they look at you and say, well, that's nothing. I don't even want to waste my time on 2 pounds a month. But 2 pounds a month is 25 pounds a year. Okay, in 2 years, that's 50 pounds. Now, of those 65% of Americans that are grossly overweight, most of them are not over 50 pounds. They're somewhere between 20 and 50 pounds overweight. Okay? For someone who's 300 pounds overweight, they're going to need a lot more than that. Okay? But we're not talking about those people. We're talking about the average person. And the average person in America can afford to lose 3, 4, 5, 10 pounds. And that is going to provide the right way to reduce the risk that we were talking about, that as you get older, getting into that Syndrome X. The whole idea is to prevent getting the Syndrome X started. Because once Syndrome X starts and you become part of it, yeah, you can treat it, you can fight it, you can do all that, but it's always better to not get to that situation. And there's plenty of doctors out there be willing to give you plenty of medication, insulin, and all sorts of pills to treat it once you've got it. But I think it's better not to get it. And this is one way of not getting it. Now, CardioMax, why do we put this in here? Well, if you think about it, if you prevent diabetes and you're preventing, what's the whole reason of preventing the diabetes, the atherosclerosis and all this stuff? Well, it's basically to protect your heart. Okay. If we don't protect the heart, obviously, there's no point in any of it. It's a lot easier to protect the heart than it is to protect the brain. And unfortunately, we do make some stupid decisions, but maybe our brain needs more help than we think. Okay. One of the fallacies that people have when they think they get a heart attack is that all of a sudden, out of nowhere, they had cholesterol was building up in their arteries, and then all of a sudden, out of nowhere, the artery got completely blocked with cholesterol. Well, that's not exactly correct. Before, remember we talked about the low density lipoproteins, the LDLs. They become free radicals, and what they do is they attack the wall of the blood vessel. And what that does is it causes the fat to be deposited in the blood vessel. Over a period of time, this gradually builds up, which is true. But the major damage that it does is, even as the plaque is forming, okay, this is not a smooth wall like the inside of a hose, okay? It is a rough, it looks like ridges on a mountain. And what happens is, as the blood is streaming through the vessel at a high rate of speed, one of these little mountains kind of gets flipped up, and it like lifts up a little piece of the plaque. Kind of like if you're spray washing your house and your house is paint that's got old paint on it, you want to spray away the paint, you get one of those power washes and you sprays it off. Well, that's what's happening, is the blood vessel is hitting that chipped paint or that chipped plaque, and it's causing it to flip off. And what happens is that plaque starts flopping in the blood vessel, and what happens is that plaque hits a platelet, and it rips the platelet open. The platelet releases medication, or not medication, it releases substances that causes blood to clot. That's why if you cut yourself, your blood clots. So what this is it's actually causing your blood to clot, not on the outside of your body, but on the inside of your body. So as that clot gets bigger, and now think about it, if you cut your hand and you get a clot, how long does it take? A couple of minutes before you have a clot and it stops bleeding? Unless you have a disease like hemophilia, or you've taken 20 aspirins a day, if you cut your hand, you're not going to bleed for 3 hours. Okay, it's going to stop within 5 minutes or so. If it doesn't stop by itself within 5 minutes, then you've got bigger problems than you know. All right? As a matter of fact, years ago, one of the tests we used to do to see if people were clotting normal was something called a bleeding time. They literally would stick somebody and count how long it takes for them to form a clot. So what happens is, within a few minutes, you have this clot that's actually blocking the blood vessel. And that's the source of your heart attack. And that's why people go in and they do, where they put the streptolysin, they put medication in there to block the clot, or to open that clot up. Oops, let me go back. Now, one of the things that helps prevent this is the omega-3 fatty acids. Now, omega-3 fatty acids are essential acids in the sense that our body does not produce them. The only way you can get them is to take them in. And traditionally, one of the ways to get omega-3 fatty acids was to eat fish. But it had to be deep water ocean fish, certain fish had the omega-3 acids. It was not every fish. So unless you had access to herring, sardines, you weren't getting the omega-3 acids, okay? If you're eating trout and tuna, you're not getting omega-3 fatty acids, or at least not a lot of them. One of the other sources of omega acids is flax seeds. And flax seeds has what the three major acids are the DHA, EPA, and ALA. The ALA from the flax seeds gets transferred into DHA and EPA. What the omega-3 fatty acids do is, remember I talked about that, first of all, it helps stop the ridges on that plaque from being rough. It smooths it out. So if you're already at this stage, which most of us are, okay, if you're at this stage, what it'll do is help smooth that out, so eventually it'll work its way down to this. Probably that. Unrealistic to get to that. But it'll smooth it out so that you don't have those, the blood vessel causing that thing to flop up and you getting the blood clot. The other thing that happens is it acts as an antioxidant to prevent this here, the vitamin E in there prevents the cholesterol from being oxidized. So you're not forming more plaque. And one thing that was noticed about the eating the fish as an odd kind of a thing, people that live in societies that have high intake of omega-3 fatty acids from diets with fish have a markedly lower rate of depression than clinical depression than people that don't eat a lot of fish. Just, but the final thing is this also has vitamin B6, B12, and folic acid. And why is that important? There is an amino acid called homocysteine that our body produces, okay? And homocysteine has been found in a lot of diseases. High homocysteine levels has been found in people with heart disease, stroke, and diabetes. As a matter of fact, some of the common medications that are prescribed, and I'm not talking about really outlandish stuff, something like believe it or not, some of the diabetes medicine, the pills, the anti-diabetic medication, some of the lipid-lowering medication that doctors give you for high cholesterol actually increase homocysteine levels. So you may be taking let's say you're diabetic and you're taking a diabetes pill, that may be lowering your sugar, but it's raising your homocysteine. So taking vitamin B6 and folic acid lowers homocysteine. There is a disease called homocystinuria. It's something that is inherited. It's a genetic disease. You're not going to catch it. But these children are maybe 1 in 100,000 born with this, so it's not very prevalent. They have high levels of homocysteine. They will usually die by the age of 30. And they will usually have mental retardation. So this homocysteine is very prevalent in strokes, heart attacks, and diabetes. So taking a supplement which is going to give you B6, B12, and folic acid, which specifically lowers homocysteine, is going to be helpful in preventing the diabetes, but also is going to be helpful in, if you're already a diabetic and you're taking diabetic medicine, it's going to counteract the effect of the diabetic medicine that's causing the homocysteine to go up. So, in summary, obviously what I've tried to touch on is, it seems to be obvious to most of us that obesity is becoming a problem in the United States. And this is a primary source of future development of diabetes as part of the Syndrome X,